Combat Medical is an innovative medical device development company. It has designed a new delivery system for chemotherapy in bladder cancer that significantly improves patients' outcomes and reduces recurrence rates. Bladder cancer is the 7th most common cancer, responsible for 150,000 deaths worldwide. It is one of the most expensive cancers to treat due to its high recurrence rate. Combat Medical has developed an innovative technology which specifically targets non-muscle invasive bladder cancer. Standard chemotherapy is delivered to patients via a catheter at room temperature. This has been demonstrated to be reasonably effective. However, due to the naturally impermeable characteristics of the bladder, the chemotherapy doesn't penetrate as effectively as it could through the bladder wall. Combined with variables such as treatment time and uncertain distribution of the chemotherapy throughout the bladder, this results in high recurrence rates for bladder cancer patients. Mitomycin C is a common standard chemotherapy agent used in bladder cancer, and the following illustrates the effects of the chemotherapy agent at the cellular level. Once the chemotherapy agent enters the cancer cell, it will target both the proteins and DNA of the cell. The proteins of the cell play an important role in the structure, function, and regulation of the cell, while DNA, the biological information store or blueprint of the cancer cell, is also targeted. The chemotherapy agent will also stimulate the body's immune system, promoting the production of natural killer cells. As the chemotherapy agent enters the nucleus of the cancer cell, the DNA becomes cross-linked, strands break, resulting in the reduction of replication and cell division. Proteins are unfolded, affecting their structure and function, causing disruption in the cancer cell's normal development, function, and replication. The Combat BRS system recirculates the chemotherapy through a closed, dry external system using a standard 3-way catheter. The catheter is easy for clinicians to insert and doesn't cause any additional patient discomfort. The Combat BRS system is CE marked and has been in clinical use since 2011. The chemotherapy is warmed to a constant set temperature of 43 degrees centigrade by an innovative patented aluminium heat exchanger. The Combat BRS heat exchanger accurately controls the temperature of the chemotherapy fluid delivered to the patient within 1 degree centigrade. The chemotherapy is recirculated up to 4 times a minute around the system and bladder for 60 minutes. This active delivery mechanism ensures a uniform temperature throughout the bladder wall, tissues, and cancer tumors. This optimizes chemotherapy distribution around the bladder. The synergistic effects of warming chemotherapy in bladder cancer has been shown to significantly improve the effectiveness of the treatment compared to chemotherapy delivered at room temperature. By increasing the temperature to 43 degrees centigrade, it increases the drug penetration through the bladder wall into the cancer and increases the cytotoxicity by up to 10 times, killing the cancer more aggressively. At the cellular level, there are a number of synergistic effects when combining chemotherapy and hypothermia. One of the earliest effects is vasodilation, increasing blood supply to the bladder and the tumor. Mitomycin C, the chemotherapy agent, proven to be stable at higher temperatures, has been shown to be 40% more active and effective at 43 degrees centigrade. Due to the basic laws of thermodynamics, processes occur more rapidly at higher temperatures. Cell membranes become more permeable, resulting in higher intracellular concentration of the chemotherapy. Heat-stressed cells signal to the activated immune system natural killer cells by producing heat shock proteins on the cancer cell surface. The cumulative effects result in proteins being denatured and unfolded. DNA and protein are broken down, and the cancer cell is ultimately eliminated through programmed cell death, apoptosis. Healthy cells are able to manage and dissipate the heat more effectively than cancer cells, so are better preserved. Due to the simplicity and ease of use, the Combat BRS system fits in with current clinical practices, so it won't substantially increase resources required or clinicians' time. At the end of the treatment, the BRS system also enables you to remove all the cytotoxic chemotherapy drug and dispose of it safely. Combat BRS's chemohypothermia delivery system, a new and innovative way of treating bladder cancer.